In today's video, I'm going to debunk 3 of the biggest myths about pain. Welcome to my channel. My name is Chadwick Oliveira, and I'm a doctor of physical therapy, and I have a clinical practice in helping those with chronic pain. I'm a clinical instructor. I'm a Navy veteran, and I have a personal history of chronic low back pain and PTSD. Myth number 1, no pain, no gain. This is a common misconception, and it really came out of working out in the gym, where people are encouraged to lift weights or exercise up to the point where their muscles burn. The burn can feel uncomfortable or painful, and that is the type of pain that they're talking about. When they say no pain, no gain, they're telling you to go up to the point where it burns, and that's how you know that you've stimulated the muscle for growth. The thing that will accompany that is that your muscles will fatigue and you'll physically be unable to lift the weights anymore. If you're experiencing sharp pain while running or doing any kind of lifting, your body's alarm system is going off and it's trying to protect you from doing something potentially harmful. Working past that is potentially dangerous, and your body is trying to communicate that with you. If you're just feeling muscle burn that is accumulating with every repetition and every set, then you can continue to push that. Your muscles will fatigue. That burning sensation is a buildup of lactic acid that's a byproduct of sustained or rapid muscle contractions. Once your body has built up enough lactic acid, your muscles will fatigue and you'll need to rest. Your body will naturally do that for you because you just won't be able to continue doing the activity. You'll need to rest before you can continue. When you're resting during that period, your body is trying to remove waste and replenishing nutrients that it needs in order to continue. After repeating that process several times, you'll get to a point where your muscles are fully fatigued. And at that point, they need an extended break of 24 to 48 hours, depending on the intensity of the work. And then you can continue working with that specific muscle group. If you're experiencing sharp pain anytime during the set that is not associated with that muscle burn and fatigue, then you should stop and reconsider how you're lifting the weight or how much weight you're lifting, because your body is telling you, it's giving you a danger signal that what you're doing could potentially result in harm. Second myth is, I just have to live with my pain. Everybody has pain, and not everybody has pain that lasts for 3 months or more. That is our definition for chronic pain. If you are experiencing pain for 3 or more months, then your body is in this state of chronic pain, and not everybody has that. So the idea that you have to live with your pain is depressing, for one. It's discouraging. This idea that we're going to adapt or acclimate to pain. And in some instances we do, the pain stops being as severe, but it's just there, it's at a lower level, and we just shrug our shoulders and go, well, there's nothing that we can do about it. When in reality, there's a lot that you can do about it. There's a lot that you can do to prevent it. There's a lot that you can do to be reactive to it. Medications can sometimes help. 90% of this is going to come from what you do. And since everybody's problems behind their pain are different, just like everybody is different, you have to come up with a solution that's unique to you. A lot of built around lifestyle changes where you're going to be improving. You need to improve your sleep. You need to be engaging in more relaxing forms of exercise. And you need to make sure that you're fueling your body correctly. You require some stress management. In today's modern world, things are rapidly changing, and there's potential for stress everywhere. If you're prone to stress, then this is a big problem for you, because you have to identify these stressors or these pain points, triggers, and start systematically dealing with them one at a time. It's a lot of work, and there's no one size fits all solution for people in this problem. So when I get the question, how long is this going to take for me to be pain free? The answer is, I honestly don't know. I can't tell the future. I don't have a crystal ball. And I really wish I did. That answer frustrates me, because I want to help you, and I want to help you as quickly as possible, because living in pain or living with PTSD, it weighs on you like a heavy bag. Or my personal feeling around PTSD was that it was like I was carrying armor around all the time. And when I looked at my solution uh, and how much work I had to do, it felt like I was going to climb a mountain. And the visualization that I had was that I was standing at the base of a mountain, and I couldn't see the top, which means I had no idea what obstacles were laid out before me, and I didn't know how long that would take. I just knew that I had this monumental task. Once you get started, and that's really the hardest part, is getting started. Once you get started, if you focus on making small changes every day and continuing to push forward, you will have setbacks. That's okay. You keep pushing forward anyways. And over time, things do get better. You look back at what your life was 3 months from now or a year from now, and you can see that you've made some changes. And that encourages you to keep going. It's simple in that we can all write this down on paper, and it'll make sense, but it's not easy. The hard part, what makes this difficult, is the consistency, doing it every day. So one thing that I found valuable was to have a why. Why am I doing this? And for some people, that's going to be easy. You're probably saying, well, I know why I want to do it. I want to live pain free, or I want to get back to the life that I had. And those are good whys. Better whys would be, I want to be happy. I want to travel. I want to spend time with my friends. I want to sleep better. I want to do things. I want to learn stuff. I want to go places. Focusing on some positive changes that you want in your life are better than focusing on your pain and being pain free. Pain free is unrealistic, because we do experience pain from time to time. 90% of the time, I don't experience pain, or I don't experience PTSD symptoms. I have been working at it for long enough to know that when I do have pain for doing something as simple as picking my daughter up, it is temporary, and I'm able to move past that point. I'm able to get back into the present and continue moving forward. Everybody wakes up some days and they still feel tired, or maybe they've got a pain in their shoulder, their neck, or their back. It's common, and it's those types of pains oftentimes seem to come and go. And when you're having chronic pain, or you're in a state of chronic pain, it might be high intensity all the time. You're still going to experience those days where it is worse, or you feel like you're making progress and then you have a setback. The journey is what you want to focus on, along with the end in mind. And day by day, you want to be making sure that you're staying on course and that you're making small changes that will add up over a long period of time. Myth number 3. This is one that I hear a lot from my patients. Anytime you start talking about the physiology and the mechanisms of pain and neuroplasticity, you inevitably get to the point where you're talking about the nervous system and the brain. And people will ask me, so it's all in my head? And the answer is no, it's not all in your head. Your brain is located inside your skull. However, the nervous system extends all throughout the body. The brain does produce pain. It does it, though, to protect you in the same way that it alerts you to being hungry, or in the same way that it alerts you that your bladder's full and you need to go pee. In order for your brain to produce that, it has to get a stimulus from the body first. And then it projects out to the body what it's feeling and where, and then you're able to act upon it. Your brain's top priority is to protect you. It's to protect you. It's to make sure that you have food to sustain yourself, and it's there to help you. It's there to help you reproduce. So once you get to that point, now you're definitely still worried about yourself, but you're also worried about your offspring. And if you're reproducing and you don't feel safe, or you don't have resources to sustain your life, then that's a complicated situation, and it can get bad real fast. It's all in my head. It's a myth, and it really just insinuates that you're making it up to get attention, and that's not true. Your pain is real, and neuroplasticity is real. That happens all the time, every day, and most of us don't even realize it. These changes can become permanent if you allow them. And there's this concept of the elephant and the rider, where there's parts of the brain that are automatic. They just do things like your heart rate, your breathing. Those are tasks that have been delegated to the area of the brain that does automatic things. Your pain response is part of that system. However, your pain response, that system has to communicate with the rest of your brain so that you know where a problem lies. So the body and the brain have to be talking to each other. It's all in my head. It's insinuating that you're making it up for attention, and that's insulting because it's dismissive, and healthcare practitioners are accused of that on a regular basis when we are attempting to educate our patients on chronic pain. It's a delicate situation, and we are trying to do everything that we can to help the patient out. So your pain is real. It's not all in your head. And we can help you with it. It takes time, it takes effort, and sometimes it takes some medications. And the help and support that you need might be multifactorial. We have multiple experts in the healthcare system: physical therapists, psychologists, pain management, physicians, surgeons. All of them may be necessary as part of your team to help you with your chronic pain. And where you could really get the furthest is when you are taking an active role in all of it. If you were only having one issue that was complex, as chronic pain is, you got to systematically break that down. Not everybody has just pain. There's usually a blend or some overlap. There's autoimmune disorders that are associated with chronic pain. Many people with PTSD, they got PTSD because they suffered a physical trauma. And not only is fear and avoidance a big part of their symptoms, but pain is often associated with that. So again, it goes back to that thing where we can simplify it for you. However, it's not easy. And simply taking a pill or going to get a surgery and expecting your pain to go away, there's certain people where that just doesn't work. It's not true. Now, there are some people out there who get a surgery or do take a medication and their problem does go away. Great for them. I know they're out there. I know they exist. But in the healthcare system, we are having to work together and collaborate to help those where it's a little more to a lot more complicated than that. If you found value in this video and you want to support my work, then like, share, and subscribe. If one of these myths are something that you would like to comment on, then comment down below, and I will see you in the next video.